Dr. Deidre Willis is our program manager. As I said, at this time, we are experiencing a bit of technical difficulty, but we're going to try and alleviate the issues that we're having so that we can proceed with the podcast. Again, thank you for joining us here tonight on Health Talk. As I stated before, I am Ferris Corbett. I am the project, the program manager, and Dr. Deidre Willis is our project manager. Um, as I said, we are having some technical issues at this current time, so I'm asking you to bear with us as we try to work through these technical issues. We are super excited that you are able to join us and be a part of our podcast on this evening. And I'm hoping that everyone is able to hear us. As I said, we are experiencing some technical difficulty at this time. We do see our project manager is trying to get on. Dr. Willis, I am trying to get that link over to you because we are, like I say, we are experiencing some technical difficulties at this time. Uh, so bear with us. Like I said, I hope everyone can hear us and everything. And Dr. Willis, like I said, I am trying to get that link over to you so that you can join us here in just a minute. So you all bear with us as we try to make these corrections here, try to get these things, these technical issues straightened out here. And we do apologize for the delay, and we do apologize for the inconvenience, but we are experiencing some severe technical difficulty at this time. So I'm asking that you bear with us. Um, we may have to disconnect for just a brief moment. However, we will resume. As we stated earlier, for those of you that just joining us right now, uh, we are experiencing some technical difficulty at this time. Uh, I'm like in a rural area, and the connection here sometimes can be pretty much challenging. So I do apologize for that. And I thank you for joining us here on Hip Talk. Like I said, there may be a brief disconnect for a brief moment as we try to sort out this technical issue, but we will resume. So bear with us. And at that time, Dr. Willis, uh, hopefully we'll have things worked out that we can go ahead and get that link sent over to you. So please stay tuned, stay with us. I am going to disconnect here at this time, but I will be coming right back. So please join us back once we reconnect, because we are experiencing some very severe technical issues at this time. Bear with us, please. Thank you for bearing with us as we try to work through our technical difficulties. Uh, so we're going to go ahead and we're going to try to move forward. We're going to try to go ahead on and start up again with this. I just received a notification that Dr. Willis is not going to be able to join on this evening, but she will be with us on our next uh, podcast. Again, thank you for your patience. Thank you for your understanding as we attempt to try to work through these challenges that we're having with our connection here. Tonight's topic, we're going to just talk about some herbs and supplements for arthritis and joint pain. Again, as our disclaimer, we're not here to provide any type of diagnoses or anything of that nature. We're simply here to provide health information and health education on various health topics. Again, thank you for tuning in to Health Talk. Health Talk is a part of He Cares Training and Education Center, where yours truly is the project director. Tonight, as I said, we're going to be talking about arthritis and joint pain. It's a common medical condition that typically cause inflammation in the joint and the tissues that surround the joint and other types of connective tissues. There are various forms of is osteoarthritis. Another form of arthritis is gout and fibromyalgia, or either RA, which is rheumatoid arthritis. These are some the most common type of arthritis. Now, there are several factors that can contribute to the development of arthritis, and these include things such as any type of injury, any type of abnormal metabolism. There could be some type of genetic makeup, or there could be some type of infection. All these things are some contributing factors to the condition of arthritis. Now, there are the typical treatment that are associated with arthritis includes a combination of using medication, physical therapy, as well as providing patient education. And that is to provide with that education portion of it, that education information portion of it, to provide a more insight into uh, helping to treat or deal with the condition of arthritis. Now, there are several supplements and herbs that can help one to manage the joint pain that are associated with arthritis. Now, more natural medications are being used to, are being tested, or being used in well-designed clinical trials to determine the effectiveness of these uh, uh, herbs and supplement in their treatment of arthritis. Uh, there, there are too many products in advertisement for arthritis that do not measure up, or even it is of a good practice to discuss. taking any type of herbal supplement or any herbal treatment, it's a wise decision to have that discussion with your healthcare provider, as we said, because there could be some interaction with some medication that you are taking. All right. So tonight we're going to talk about at least 10 herbs and supplement for arthritis and joint pain. Again, as our disclaimer, we're not here to diagnose or to provide any type of treatment. We're here just simply to provide you with health education and health information. So one of the one of the herbal treatments to help arthritis and joint pain. Many of you may have even heard of this, and it's called glucosamine. Now, this is a glucosamine is a natural cartilage, particularly in the fluid around the joint. This is something that is naturally found within our body, glucosamine. And for the herbal or the supplement part of glucosamine, it is harvested from shells or shellfish for the dietary supplement portion of it. So you may want to be caution about that if you have an allergy to shell or shellfish, because the dietary supplement of glucosamine is made uh, from the shells of the shellfish. So if you have an allergy to shellfish, you may want to use precaution in that area. Now, some studies have explored the, the uh, potential of glucosamine in providing relief of people that have arthritis or arthritic condition. The second one that we're going to talk about is fish oil, and I'm sure many of you have even heard about fish oil as well. Fish oil in omega-3 fatty acid, and I'm sure a lot of you have heard the discussion about fatty acid and the omega-3. Um, the fish oil or the omega-3 fatty acid, it's converted in our body into anti-inflammatory chemicals called resolvins. So, so omega uh, fats, they're they're found in, in oily fishes such as tuna,